Hello and welcome to the Week in Review, the April 1st edition of Week in Review for Module 4. Hey, congratulations, you are halfway through the course right now, so we're almost, we're over the hump, kind of. I think the big assignments are on the horizon, though I'll talk a little bit about that. But let me talk a little bit about last week. I think the big takeaway from last week that I found was your discussions about graduate school. Now, there really is no right or wrong answer. Continuing on may not make sense for some individuals. The timing of when to continue on may not make sense. And then for other people, this is the time to do it, to go on, to go further into graduate school. Now, I did give you a list of some of the kind of the more popular options for graduate school. Please look at those. And, by no means is that the entire list. There are a lot of different avenues that you can go. But here's a couple of, things to talk about. One of them was, I saw this recurrent in a couple of threads. I think Sean talked about it first, and then a lot of you replied back on it. And that was RA school, being a radiologist assistant. This is a very interesting area. But with the RA position, I would exercise caution, and I would also look at, make sure you do your due diligence. In other words, do your homework on this position before you sink $30,000, $40,000 into a graduate school education. I have yet to meet an RA. Oh, I take that back. I met one RA. And this was in Indiana. She started as an RA in Texas and has been transversing the country for employment. So what that told me, and we talked, she had a very frank discussion about it. She was not really happy with where it has gone for her. Originally, it was set up really great. She was going to work for the radiology practice where she was doing her internship at, but money, business decisions came into play where they had to let her go, and her finding positions became difficult. Now, with the Affordable Care Act, who knows what's going to happen? I would just say that it's a question mark. Whenever you enter something with a question mark, there could be tremendous reward because you're one of the first, you're a leader in that area, but there can be tremendous risk. So please evaluate that. A less risky route to go in that same avenue is a physician assistant. So that would be something that you may want to explore. Extremely competitive area. You would be required to pick up most likely some higher level chemistry, some organic chemistry, some calculus, before entering a program like that. Each is a little different, but you have the foundation in that you already have a baccalaureate degree. So please look at that. But the other thing that came up was this continuous focus on pretty much what I would consider a linear pathway within medical imaging. Being an RA or still being within that medical imaging, that kind of that vertical channel. Please try to break that thought pattern. Think outside of that area in multiple areas that are maybe surrounding medical imaging. Use your clinical expertise and background as foundation and leverage into other areas of healthcare management, healthcare sales, education, etc. May not necessarily be directly in imaging anymore, but you do have that clinical foundation, which is important. You can walk the walk and talk the talk. You've been there, you've been on the floor, you've been with patient care, you know what that's about, even though you might be in a managerial, supervisory role within healthcare, or even in a sales setting. I think that's even great. We're talking to one of the students, and leveraging that clinical expertise, maybe in medical device sales. Many of those people don't have a medical background. You do. So, again, think broader, I think there are a lot of opportunities. If you have blinders on, you're going to miss that. It is a kind of a big world out there as far as how you can leverage those skills that you have. Please do so. Okay. So, and then lastly, on graduate school, it is a big investment. For myself, it was well over $600 a credit hour. And right now, I'm going to school. It just never stops. And it is, still over, $600 a credit hour at the doctoral level. So it's, it doubles. Now, again, formulate how it works best for your own career path. I would say that the foundation of the American middle class is developed around that baccalaureate degree, which you have. That's kind of the typical, mainline education is that baccalaureate level. You have that now. It's whether you decide to separate yourself a little bit from the pack to have that master's degree. So, okay. All right, excellent. Moving on from that topic, but great discussions there. If you do have any questions, if you decide to go forward with a degree, I know Carmen and I have been talking for many, many months, please feel free to contact me. I'd be happy to discuss it. Kind of ask you, some things to look for when you are looking for a quality program, a quality school, and how best that degree can be leveraged in multiple areas. So keep that in mind. Okay, now let's talk a little bit about this week. With the workbook activity, excuse me, we're going to be looking at really demonstrating your value to the organization that you're with or a potential employer. That's very important. I know a lot of us resist kind of tooting our own horn, but quite frankly, you have to. So if you haven't learned that lesson now, now is the time to understand that. And there really is it's a subtle difference, but important difference between, bragging and tooting your own horn. But I think you'll have some activities this week to kind of master those differences, and it's something that you do have to do if you're looking for career advancement, or again, just showing that, hey, I'm a valuable employee and here's all the things that I do, and you may not realize it. Because quite frankly, if you don't tell your manager, they may not know of the significant contributions that you make. So please go through those activities this week. Then also we're going to have a discussion on something very important that we do not address within higher education, but can be a career killer or a career accelerator. And that is the all-important soft skills. There is no one magic bullet. You can't just say in life, have a PhD and life will be golden. That's not true. You could have a PhD, have a horrible personality, nobody wants to work with you, and your career may go nowhere. So it does take a balance of soft skills, education, work ethic. There's a lot of things that come into play that increase your chances for a successful career. And I say chances. Of course, we all know stories of horribly mean people who have risen to the top either through brutality or sheer luck. But again, I think it just makes common sense that in order to increase your chances for success, having some of these soft skills are very important. So please look at that. Take a true self-evaluation. I know that for me personally, I tend to be more of an introverted personality, so I always have to focus on kind of pushing that out a little bit and not being so within myself. So there's my little self-assessment, and I'm always trying to get better at that. So look at that discussion on soft skills. Also, this week is kind of light on work, and the reason for that is I want you to please work on your case study. I've talked to all of you about that case study. Again, I found numerous resources that directly relate to the case study just in the past week that should be helpful out there. I think I've talked to all of you about going to Radiology Today, Imaging Economics. all those kind of those 3 magazines that I highlighted in the course news. Go through there, peruse the back issues. You should be able to find something within the past 24 months on almost all those topics, in addition to your normal research. So please use this week to work on the case study. All right, well, that concludes this week in review. If you have any questions or comments, you know how to get a hold of me. And as always, thank you for watching.